thoracic duct is the largest lymphatic duct in the body. It is about 45 centimeter long and the lumen is 5 millimeter. And it drains the most part of the body except the right upper quadrant. The thoracic duct drains the most part of the body except the right side of the head and neck, the right side of the chest wall, the right lung, right side of the heart, right surface of the liver and the right upper extremity. These areas are drained by the right lymphatic duct. You can see the right lymphatic duct, and the rest of the areas in the body are drained by the thoracic duct. In this picture we are seeing the thoracic duct. You can see the thoracic duct is, I told you already, that is 45 centimeter long. What is the extension of this thoracic duct? Extend. You can see it extends from the 12th thoracic vertebra. You can see the T12 vertebra extends from the 12th thoracic vertebra. Okay, it runs upwards and ends by opening into the junction between left subclavian vein and the left internal jugular vein. Left subclavian vein and left internal jugular vein at the level of 7th cervical vertebra extends from T12 to C7. So here you can see there is a part called cisterna chyli. What do you know about cisterna chyli? Cisterna chyli is a large lymphatic sac which forms the commencement of this thoracic duct. This is how the thoracic duct look like, but at the beginning the thoracic duct begins as a large blind sac that is known as the cisterna chyli. This particular cisterna chyli, okay, this particular portion lies in front of and bodies of first and second lumbar vertebrae, right to the abdominal aorta, behind the right crus of diaphragm. Behind the right crus of diaphragm. That means, now let us see the formation of this thoracic duct. Okay, I already mentioned that the thoracic duct begins in the abdominal cavity at the level of lower border of T12, that is opposite to L1 and L2 vertebrae. So here we have the diaphragm. It enters the thoracic cavity. Okay, it enters the thoracic cavity through the aortic opening of the diaphragm. Okay, first point what you need to write is cisterna chyli opposite to L1 and L2. Okay, then it enters, next point is enters the thoracic cavity, thorax, through the aortic opening of diaphragm. You know, aortic opening of diaphragm which lies at the level of 12th thoracic vertebra, T12. Next, so now this thoracic duct is in the thoracic cavity. It ascends upwards. Okay, where you can see in the thorax, it lies in the posterior mediastinum. Posterior mediastinum. Okay, ascends upwards in the posterior mediastinum, and on reaching the level of 5th thoracic vertebra, so this particular thoracic duct goes to the left side. So next point is at the level of T5, shift this particular structure, shift to the left side. Next point is it goes to the left side and enters the superior mediastinum. Remember, superior mediastinum. Okay, then it ascends upwards in the left part of the superior mediastinum. Okay, when it reaches the superior mediastinum, you can see that it lies left of this esophagus. The relation is it lies left of this esophagus. Then it at the level of 7th cervical vertebra and ends by opening into the junction between left subclavian vein and the left internal jugular vein. Left subclavian and left internal jugular vein. Now let us see the relations of this thoracic duct. So now let us see the relations of this thoracic duct at the aortic orifice. Anteriorly we have the median arcuate ligament, and posteriorly we have the 12th thoracic vertebra, body of the 12th thoracic vertebra. Then to the right side we are seeing this azygous vein. Right side we have the azygous vein, and the left side we have the aorta. left side we have the descending thoracic aorta. So these are, now let us see the relations of the thoracic duct in the posterior mediastinum. Okay, so through this aortic opening of diaphragm it enters thorax. Okay, in the thorax it lies in the posterior mediastinum. Okay, so normally anteriorly we have the structures like diaphragm, descending aorta and esophagus, and posteriorly it lies in front of the vertebral column. So definitely we have the vertebral column connecting the anterior surface of the body of the vertebra. So we have the anterior nuchal ligament. Then we have the terminal part of hemiazygous and accessory hemiazygous vein and the right posterior intercostal arteries. So now let us see the structures related in the superior mediastinum. Anteriorly we have the arch of aorta. Then we have the commencement of left subclavian. Then we have the posteriorly vertebral column, and the onto the right side we have the esophagus here, and to the left side we have the left lung and left pleura. Now let us see the structures related at the root of the neck. Okay, so anteriorly we have the carotid sheath, posteriorly we have the vertebral artery and vein, we have the scalenus anterior muscle, phrenic nerve, and the thyrocervical trunk. Thyrocervical trunk is the branch of subclavian artery. What are the tributaries of this thoracic duct? So in the thorax, what are the tributaries? Okay, the first one you can see a pair of descending lymphatic trunk. You can see a pair of descending lymphatic trunks. They are coming from the posterior intercostal nodes. Posterior intercostal nodes. Okay, from the posterior intercostal nodes, the lymph drains into the thoracic duct through this descending thoracic lymph nodes. Okay, and there are lymph also coming from the posterior mediastinal lymph nodes. Posterior mediastinal nodes. Okay, and you can see there are a pair of ascending lumbar lymph trunks. Now, what are the tributaries in the neck? You can see in the diagram we have the left jugular lymphatic trunk, left subclavian lymphatic trunk, and the left bronchomediastinal lymphatic trunk. These three drains into the thoracic duct at the neck. So let us see what are the chances of the thoracic duct getting injured. The first one, the thoracic duct is a colorless structure which is present in the posterior mediastinum. Okay, so this structure may cut during surgical procedures. So what happens if there is an injury to the thoracic duct during any surgical procedures? So in the thoracic area, if it get cut, what happens actually? So this chyle enters into the pleural cavity. Okay, the chyle may enters into the pleural cavity and it may leads to a condition called chylothorax. Chylothorax. The cervical part of this thoracic duct also may get damaged during the deep dissection of the neck. So if there is an injury to this particular cervical part, it has to be ligated immediately. If it is not ligated or if it is not noticed, so it leads to the lymph keep on coming out of the thoracic duct, and it leads to a condition called chylous fistula. Chylous fistula.